half of your residents may experience some form of dementia. Some of your residents may just have a little problem with short-term memory, not being able to recall things easily. Other residents may be much more forgetful and even have unusual fears or concerns. Some residents all the way through the end stages of dementia may lose the ability to communicate, to formulate thought processes, even to have their basic needs of life met.
Dementia is not a specific disease. It's an overall term that describes a group of symptoms associated with a decline in memory or thinking skills severe enough to reduce a person's ability to perform everyday activities. Alzheimer's disease accounts for 60 to 80% of cases of dementia. Vascular dementia, which occurs after a stroke, is the second most common type. Changes in the ability to communicate can vary, and they're based on where the person is in their disease process. Some of the changes you might see include difficulty finding the right words, using familiar words repeatedly, describing familiar objects rather than calling them by name, easily losing a train of thought, difficulty organizing words logically, reverting to speaking a native language, speaking less often, and relying on gestures more than spoken words.
Communicating with persons with dementia is a little different than the way we might communicate with others. We want to make sure they understand what we're saying to them. And one of the best ways we can do this is to use both verbal and nonverbal communication. We want to speak slowly enough that they're able to understand what we're saying. At the same time, we want to make sure that we repeat anything that's not clear to them.
Follow these additional tips when communicating with residents with dementia. Give the person time to respond. Don't interrupt or finish sentences for them. Be patient and supportive. Offering comfort and reassurance can encourage the person to explain his or her thoughts. Avoid criticizing or correcting. Don't ever argue with the resident. Don't overwhelm the resident with lengthy requests. Offer clear, step-by-step instructions when completing tasks. Give visual cues. The resident may recognize objects better than they do spoken words. Sometimes the emotions being expressed are more important than what is being said. Look for the feelings behind their words, such as anger, frustration, or possibly pain.
This is the time we need to be supportive. Identify, I can see you're frustrated. Me too. We've got to figure this out. Or, I can see why you feel this way. May I help with this? Or, hey, you did a great job on this part of the project. We can figure this other thing out together. Make sure you're there emotionally and with your words, encouraging and supporting the resident. You may sometimes ask yourself, what's wrong with my resident? I'm only trying to help him. I want to give him a bath so he feels good. I want to put nice clean clothes. He's giving me such a hard time. He's resisting and stiffening up and not wanting me to provide any care. What's wrong with this guy? Well, what may be wrong is his dementia, his fear, his embarrassment about requiring assistance with activities of daily living. So it's important that we preserve dignity whenever we are assisting a resident with personal care. One of the most important ways we can do this is to just be pleasant and matter of fact. Engage the resident in pleasant conversation. Know your residents' favorite pastimes or topics. For some residents, it might be talking about fishing or hunting or favorite spots that they've gone to. For other residents, they may like to talk about what they're going to be doing that day or what's going to be served for breakfast. But engage them in pleasant conversation. This distracts them sometimes from the embarrassment of receiving personal care. Compliment them on how nice they're going to look. But we want to be genuine in our discussions with our residents. When a resident begins to resist care, we want to back off a little. Never become more forceful just because they're becoming resistant. That doesn't work. Allow them to do as much of the process as they possibly can. You may put the soap on the washcloth and hand it to the resident, but allow them to scrub their face rather than you reaching out to do that.
Residents with dementia, particularly in later stages, are at risk for wandering.
Wandering can sometimes be an expression that the resident is not feeling right. Something's wrong and they're looking for the answer. They're walking about, they're trying to find something to help them feel better. In that case, engaging a resident in an activity, making sure they're not hungry or thirsty, or maybe they have to go to the bathroom, or maybe they're tired and want to put their feet up. This is where your relationship with your resident and guessing what their individual needs or preferences might be at that time is so very valuable. Wandering can also come simply from boredom. They're sick of sitting in the chair. They want to get up and move about and look at something new, experience something different. So again, this is a time we can walk with the resident. If you are working in a specialized memory care area, please never underestimate the resident's ability to leave the community. Always on your shift, you will want to be making sure that doors have appropriately closed and latched. Whenever you go in and out of the unit, as you exit the door, stop, turn, make sure the door latched, then continue on. Never just walk out the door and head along. We want to make sure that the door has appropriately latched. When visitors are in, make sure the resident doesn't do something called trailing. That's where, as a group of people may be going out the door and saying their goodbyes, the resident just joins with them and heads right on out the door. You know, some of our residents look so young and so vibrant, not all the visitors even realize they're another resident. And so I've had family members actually hold the door open for a resident to exit the memory care area. We want to keep an eye out for that because that's definitely a safety concern. Sundowning is a unique set of behaviors that as the day wanes on, it becomes 4, 5, 6 o'clock in the day or later, the resident may experience some changes. They become a little more anxious or a little more concerned. So for some residents, right after supper, allowing a very quiet activity where they can sit in their recliner, maybe watch some television, look at a magazine, can help avoid some of the sundowning, wandering, and agitation. They just need a calm, quiet environment and some rest to prepare for their nighttime sleep. Others, the last thing you want to do is leave them alone when it's sundowning time for them. They need activities. They need very strong programming. Let's make some popcorn. Let's go out into the common area and maybe play some simple board games. Engage in conversation, maybe do some reminiscing. But for most of us, it's the time of day we start to quiet down. But for many residents, they do have to be kept very busy or the agitation will grow. Soothing music, even using pleasant scents, can help avoid some of our sundowning problems. Learn what works for your resident.
Quality dementia care is one of the most important services offered in a senior living community. Use the tips you've learned in this video to provide outstanding care to your residents.